Welcome to Well Beyond Medicine, the world's top-ranked children's health podcast, produced by Nemours Children's Health. Subscribe on any platform at nemourswellbeyond.org or find us on YouTube.
Each week, we'll be joined by innovators and experts from around the world, exploring anything and everything related to the 85% of child health impacts that occur outside the doctor's office. I'm your host, Carol Vassar, and now that you're here, let's go.
Let's go, well beyond medicine.
Welcome, everyone, to the Nemours Well Beyond Medicine podcast. I am so pleased to welcome Dr. Larry Moss. Dr. Moss is the president and CEO of Nemours Children's Health. He is also the man whose vision has created, or is working to create, the healthiest generations of children by going well beyond medicine, which is the impetus of this podcast, the inspiration for it. Thank you, Dr. Moss. Thanks for being here.
Nothing I like doing more than being on the Well Beyond Medicine podcast. So Thank you for having me.
And we're here to talk about whole child health. It's kind of the next iteration in Well Beyond Medicine, getting to that healthiest generations of children. Let's start with the basics. What, in your vision, is whole child health?
The whole child health model, which really is the guidance behind all of the care Nemours delivers and everything that Nemours does for children, is based on the concept that Nemours takes accountability and responsibility for the health of every child that we can possibly touch, not just those who are sick and need medical care. So it's not instead of medical care. We will always be there for the sickest kids who need the most complicated medical procedures and treatment. It's, and what else? What about all those other kids who maybe don't need to come in the hospital this year, but there are major determinants of health that we can have an impact on?
Why does this matter for long-term healthcare outcomes, not just for kids, but for the generations that follow them?
So I love that question because people tend to think, oh, children's hospitals, children's healthcare, that's about healthy kids. Yes, it's about healthy kids, and it's about all of the rest of us. Never met an adult who didn't used to be a child. The four major killers of adults, drags on our economy, drags on workforce productivity, are cancer, heart disease, diabetes, and Alzheimer's. We think of those as adult diseases, and yeah, they are adult diseases. And we spend $4.5 trillion a year trying to influence those diseases in adults and don't do very well. We can spend a massive amount of money and resources and influence those diseases a little bit. We can buy people an extra month or improve their quality of life for a year. But if we spend a tiny fraction of those resources in childhood, we can change the incidence of those diseases and we can change the trajectory in a profound way that we can't even think about in adult healthcare.
This makes so much sense. If we can nip it in the bud at the start, we won't have to worry so much about it as adults. How did you come upon this? What inspired you to go down this path of whole child health?
I would say, Carol, it's my personal experience as a pediatric surgeon. So I spent most of my professional life before I came here to Nemours in my current role as an academic pediatric surgeon taking care of the sickest of the sick. So my patients were the 1% of the 1% with severe congenital anomalies, advanced cancer, really complicated things. And if you have a child with one of those problems, there is nowhere else on the planet you want to be than America because we have the best providers, the best technology, the most resources. It's the sweet spot of what we do. And it was a privilege to do that and to be able to affect the lives of those children and their families. But it bothered me from the very earliest days of my career, progressively more and more and more, that for the other 99.9% of kids, America is probably the worst place in the developed world to be. I mean, not just bad, the evidence would say it's the worst in terms of basic child health indices. And I couldn't finish my career without the opportunity to do something about that. And I had the incredibly good fortune of crossing paths with Nemours, who I believe is better positioned than any organization in the country to make an impact on child health overall.
When we talk about whole child health, you have a very succinct way of summing it up. I think there are 3 points. Can you delineate those points?
Yeah, it's very easy, and it's what I believe is the key to health in our country. Number 1, understand what health is. Number 2, pay for health. Number 3, start with children. And if we do those 3 things effectively, we can transform the health of this country in relatively short order.
When it comes to that second point, paying for health, what does that look like in practice?
So paying for health is fundamentally about aligning financial incentives. In America's health system today, the system makes money, does well economically when patients are sick and when they're in the hospital. We don't pay for health in this country today. We pay for the opposite of health. We pay for volume and complexity of medical care delivered. So every financial incentive on America's health system says deliver as much health care as you possibly can, or perhaps it'd be better to say deliver as much medical care as you possibly can, and make it as complicated as possible. Operations, procedures, MRIs, CAT scans, that's where the big bucks are. And I'm not suggesting that any individual physician or nurse or provider gets out of bed and doesn't want to do the best for their patient. But I am suggesting that the overall economic pressure on the system at every level is actually for the opposite of what we want, which is health. A pay-for-health model puts the onus on the people delivering the medical care to keep patients healthy. I believe we should have a system where hospitals like Nemours make more money when people are healthier and out of the hospital, and actually lose some money or suffer a cost when an excessive amount of medical care is necessary or needed to be delivered.
When we talk about health, we've delineated, you have actually given a good reason for starting with children, which was your third point. How do you define the first point? What is health?
So we know, and this is what I'm about to say is not my opinion. This is an established fact that about 15% of health is due to quality of medical care. So we can deliver the best medical care in the world, and that has about a 15% impact on overall health. For some select few individuals who need medical care more than anything else, it's wonderful and it's great. But when we look at the health of the population, that number holds up. The other 85% are things like education and literacy, food security, safe housing, freedom from violence, avoidance of adverse childhood experiences. Those things are critical determinants of health. And if we see problems like that and try to throw more and more expensive medical care at those problems, not only does it not work, it's extremely wasteful of resources that could be better directed.
Why now? Why is this the time for transformation of this volume, this large turning of the ship, if you will?
It's always been the time. Why not 100 years ago would be a legitimate question. So this moment today is not about, this is the time we should do this. No, we should have always done this. I would say this moment is the time that is possible. So I would push the question, why is it possible now? I've had a 30-some year career in healthcare, and I have never seen a moment like today where it is so possible for major change to happen in the health system. Things are on the table today that were never on the table before. And sure, we can say it's a very partisan time and we're a divided country in many respects, but the concept of taking action that can make not only our children, but our entire population healthier, that can boost workforce productivity, that can bolster our economy, anybody from any side of the aisle can get behind that.
So much potential. One thing that is on the table and actually has come to fruition has happened in Delaware. And I understand that this is a history-making signing that happened in Delaware. It was the first pediatric global budget agreement with Delaware's Medicaid program. How does that shift healthcare from treating an illness to preventing it? And what does it mean for the families of Delaware? And is it an example to other states?
I think it's super exciting. Let me start with some context. So Medicaid is the government-sponsored health insurance program for people who have limited resources. Medicaid provides care for more than half of America's children. Most people don't realize that. So when we're talking about doing something with the Medicaid program, we're talking about over 50% of kids. So that's an important context. The Delaware Global Budget Agreement is historic. It's the first pediatric global budget agreement in this country. And without getting into the arcane details of the finances, it essentially is a pay-for-health model. It's a model by which Nemours is financially accountable for the health of kids in Delaware on Medicaid, which means we can, number one, benefit when we reduce the need for medical care and keep them out of the hospital. Number two, we can use precious Medicaid resources on things beyond medical care that can perhaps have a greater influence on that child's health than just throwing medical care at a problem. So I like for people to understand that yes, this is a financial model of care that's unique and different, but that's not what you really need to know. What you really need to know is this is a partnership between Nemours and the state of Delaware to benefit the health of children in the state of Delaware. Typically, negotiations for Medicaid involve the health system, like Nemours, sitting on one side of the table arguing for more money, and the state on the other side arguing for less money. I would conceptualize this model as we're sitting on the same side of the table and saying, how can we together, Nemours and the state of Delaware, decide how to best spend these precious resources to benefit kids the most?
Partnerships are really important here. Are there other partners, other collaborations who you see coming to the table who have brought benefit? And are there others who need to be at the table?
Everything about the whole child health model is about partnerships. So at Nemours, we're experts in delivering medical care. That's our sweet spot, and we've got standing and credibility, and we know what to do there. But for the other 85% of things that determine health, food security, housing, education, we're not the experts. So we can't do it without the experts at the table. But what I believe we can do, and what we want to demonstrate to our peer children's hospitals that we can do, and that is possible for all of us, is be the overall stewards of child health. So we can be the convener that brings these partners together that gets the job done. If it's about education, it's about early childhood and public and private school educators that we need to partner with. If it's about food security, it may be food banks, it may be the federal SNAP program, it may be other statewide resources. If it's about housing, you can imagine the myriad of partners that we would want to bring to the table. Maybe think of it like a football team. We see ourselves as the quarterback. We can't play every position, but we can direct all of us to work together to benefit kids.
Let's talk about some early wins, some early successes in this whole child health effort. Does anything come to mind aside from what has happened in Delaware that you talked about?
Yeah, I can think of all kinds of examples. I think of two big buckets of activity. One, what happens inside the hospitals and clinics, and the second, what happens out in the community. So let's start with inside the hospitals and clinics. So, I'll tell you about a little girl named Amber who has very complex medical problems and has to see upwards of 10 to 15 specialists every year. So in year number one, before the whole child health model is applied, Amber's family, who lives 150 miles away from our facility in Delaware, made 22 trips to Nemours during that year for medical care, had 8 operations on different days, back and forth. Amber missed 30 days of school. Her family missed 25 days of work. You get the whole picture.
Yeah.
Year number 2, where we had advanced care coordination focusing on making her care as efficient and family-friendly as possible, she had 7 trips to the hospital in 1 year. The 8 operations the following year were consolidated down to 1, where they were all done by different specialists under the same anesthetic. Her family missed only 2 days of work during that year, and she only missed a few days of school. That is possible when the focus is different. So that's an example inside the hospital. Outside the hospital, a good example is school-based health centers, where at multiple locations at both the preschool, elementary, and middle school level, we have health centers inside the schools. And so we're able to do well child visits, vaccinations. When a child is sick and has something like a flare of their asthma or have caught a virus or is not feeling well, we're able to see that child and provide services on site without the parents missing nearly as much work, and sometimes getting kids right back to class rather than missing a whole day of school for a doctor appointment. So a lot of things we can do very well.
Is there anything, as this rolls out, as this moves forward and sees the early successes, that can be learned by the adult healthcare system, that can be transferable to what they provide?
I'd say yes, but I think for the purposes of this conversation, I'd most like to focus on why concentrating on pediatrics can impact the population overall as a whole. And, there's a fundamental difference between child medical care and adult medical care in the sense that in adult medical care, the vast burden of chronic disease is already established. And really, the best we can do is put fingers in the dike and try to, really play whack-a-mole and deal with problems as they pop up, and they pop up in many different ways and in many different places. Unless we get control of our health as a society starting in childhood, that's the game we're always going to have to play with adult health care. So, frankly, what the adult-dominated healthcare system can learn is that they're missing an opportunity by not putting more focus on child health.
How will we know? Will we arrive? Or is this an ongoing whole child health effort that is going to continue for generations? How will we know if we've had success with whole child health efforts?
So we'll know by looking at the kind of measurement that we typically don't look at in healthcare. We tend to measure hospitals by readmission rate or hospital-acquired infections or survival rate after open heart surgery and, standard measures. Those are really important measures of quality of medical care. They are nearly worthless in terms of measuring the health of a population. So the kind of things that Nemours is starting to measure and will publicly report include things like kindergarten readiness, third grade reading level, high school graduation rate, infant mortality, population-based rates of hospital admission for various conditions. Those are the kind of things that are indicators of the overall health of children in a community, in a state, or whatever your unit of measure happens to be. We're committed to measuring those, reporting those, and ultimately influencing those to make them better.
How will families like Amber's family see this when they are coming to Nemours or any pediatric healthcare system that is implementing this kind of change? Well, how will they see that at the bedside, at the doctor's office?
Well, hopefully we are so successful in executing it that it becomes the expectation and they don't even notice because they've come to expect that. But that's markedly different than where we are today. I think we as a society will see it in a healthier population. And ultimately, that will very, very rapidly translate to adult health. For example, the economic burden of chronic disease in adults in this country is on the order of trillions of dollars a year when we look at its impact on gross domestic product and productivity. Imagine if we had those trillions of dollars back, and if we didn't spend $4.5 trillion on medical care every year, but maybe we spent $2.5 trillion, this country would look very different. Opportunities for the next generation would look different. The freedom for people to pursue things they want to pursue would look different. Our national defense would look different. Our position in the world would look different. It's a profound impact.
As we finish up here today, Dr. Moss, give us some words of wisdom from your point of view to get everyone listening on board with this whole child health effort.
I think a lot about how frustrated Americans are and should be with our healthcare system. And I think most Americans see it as something external to them, which is, happens in Washington and they can't do anything about it. Our health is about us, and it's about our children. And every American can have an influence. You can have an influence in the way that you interface with your physician and ask that extra question. Is that test really necessary? Why are we doing this? What are we going to do with the outcome? If you have employer-sponsored health insurance, as do the vast majority of Americans, take a little more time looking at those plans and orient and choose the plan that is more oriented towards the type of whole child health model or whole health model that we're talking about. If you own a business, you have impact on what kind of plans are offered. And so there are many, many ways that every American can have a voice in their own health and in their own health care.
You have the power, folks.
Absolutely.
Dr. Larry Moss, President and CEO of Nemours Children's Health, thank you so much for joining me on the podcast.
Always a pleasure. Thank you, Carol.
Let's go.